తీసుకొని అట్లే అండ లైవ్ అంటే చెప్పండి స్టెప్స్ వాళ్ళు వెళ్ళి ఈ శబ్దం
Hello everyone, a very good evening to you all. Myself, Dr. Sumedha Gupta, and on behalf of Voice of Health, I would like to welcome all the viewers who have joined us. So today, we are here for an insightful session on the topic Midlife Reimagined, a 360 approach to wellness and renewal, organized by Voice of Healthcare in association with INTAS and issue of public awareness. So to begin with the discussion, I would like to state some stats and facts about the menopause in India. In India, approximately 60 million women are currently navigating menopause, with the average onset around 47 years. Common symptoms include hot flushes, night sweats, mood swings, and vaginal dryness, which can severely impact daily life and the mental well-being. Despite the significant prevalence of these issues, awareness and education about menopause are often minimal. That leads to widespread misconception and the stigma. Access to appropriate healthcare resources is particularly limited in rural areas, making it challenging for the women to effectively manage their symptoms. Furthermore, hormone replacement therapies is underutilized, even though it can provide substantial relief. Cultural perceptions surrounding aging and menopause often discourage open discussion, which emphasize the urgent need for comprehensive education and improved healthcare service to support women during the critical transition. And in the light of these stats and facts, the aim of this session is to break the taboo around menopause by raising awareness on its signs, symptoms, and health risks. We'll address common myths, discussing coping strategies and mental physical challenges, and also promote open dialogue to dismantle the stigma related to menopause. Additionally, we'll highlight policy advocacy and support groups fostering a supportive community for women to navigating in this transition. To begin with the discussion, first, I would like you all to please join me in welcoming our experts who are going to provide us with insightful information on understanding about the menopause from A to Z. I would like to welcome Dr. Indira Rani, MBBS DGO Fellowship in Infertility Art Consultant, Gynaec and OBS, Shreya Shraddha Infertility and High Risk Pregnancy Clinic, Vidyanagar. Moving ahead, I would like to welcome Dr. Shilpa, Gynaecologist, Fertility Specialist and Laparoscopic Surgeon, Rajashri Grandhim, Speciality Hospital, Bangalore. Good evening, Doctor. Welcome to the discussion.
Good evening.
Moving ahead, I would like to welcome Dr. Rabiya, Gold Medalist, DGO, Gynecologist and Fertility Specialist, Tripura Gastro and Gynaec Hospital. Good evening, Doctor. Welcome to the discussion. Moving ahead, I would like to welcome Dr. Tamarai Ram, MBBS, DGO Consultant, Sonologist and Gynecologist. Good evening, Doctor. Welcome to the discussion.
Good evening. Thank you for inviting me to participate in this group.
You're welcome, Doctor. So let's begin with the discussion. So to talk about understanding about the menopause, I would like to know the views of Dr. Shilpa. Can you please tell us at what age do women typically start experiencing changes related to menopause and how can they prepare for this transition?
Good evening, everyone. Thanks for this opportunity, Intas. See, menopause is one point in our continuum of life stages of women. It marks the end of their reproductive years. So menopausal transition can be gradual, usually beginning with changes in the menstrual cycle. Perimenopause refers to a period from where these signs are first observed. It ends 1 year after the final menstrual period. So generally, women should be made aware of this particular transition and their changes in their physical, mental, social And all these changes should be made aware for all these women. Awareness should be made at the level of families, at the level of physicians. Menopausal women may not visit only gynecologist all the time. They may visit any particular specialty doctors. As in, they may meet dermatologists, they may meet physicians, they may meet psychiatrists. So the awareness should be made at each point. Also, awareness campaigns can be done in social media and at public level. The preparation starts from maintaining their general health, as in maintaining their ideal body weight, and maybe menopausal health should be taken as a national health program where their general health conditions are addressed, so that that will become a window of opportunity for doctors also to look
Yeah.
at their problems at this transition and which can be addressed.
Thank you, Dr. Shilpa, for providing us with insights on the age of onset when it comes to menopause. Moving ahead with the discussion, I would like to welcome Dr. Indira, Fellowship in Infertility Art, Gynae and Ob, Shreya Shraddha Infertility and High Risk Pregnancy Clinic. Doctor, welcome to the discussion. Dr. Indira, can you hear me? I think there is some network issue with Dr. Indira. Moving ahead with the discussion to Dr. Tamarai Ram, if we talk about the health implication when it comes to menopause, can you please provide us with insights on how does menopause impact a woman's overall health and what specific health checkup should be prioritized during this time?
Okay, first thing is I just want to make it very clear that menopause is not an illness. It's just a transition period from normal reproductive period to the menopausal thing. So, how smooth we take it is more important. Most people will have a smooth transition. At least 50 to 60% of the people will have a smooth transition. Some of them will have like severe complications which will need some surgical treatment. But most people with slight lifestyle changes and regular screening, I think we can move into a smooth transition to menopause period. And we all know menopause is like because of the hormone changes and this low estrogen levels. And the low estrogen levels play a varied role in our system, in different systems actually. And first thing is, I would like to tell you that estrogen, the low estrogen levels regulate our cholesterol levels and they regulate our arterioles, the flexibility of the arterioles. Hence, the normal estrogen levels will try to maintain these, and then when it becomes low during the menopause, there are more increased chances of getting a cardiovascular disease. That is one. Next is decreased estrogen also increases the bone loss, which causes osteoporosis in postmenopausal women. So we need to know about that bone loss. Next is the mental health because of all the various symptoms, all the hot flushes and vaginal dryness and all other symptoms. Most people have this mental illness. They feel very uncomfortable, mood swings, mood depression, and some cognitive behavioral changes may be there. And then, as in any other aging process, they can be like weight gain and metabolic disorders, like along with menopause, maybe thyroid and sugars. So we need to be aware of all these. And of course, we need to monitor for cancers, breast cancer, cervical cancers, ovarian cancer. So these are all the in this age group which we need to be aware of.
Thank you, Dr. Tamarai, for these insights onto that when it comes to the health implications. Moving ahead in the following up question of that, can you please provide us with insights on symptoms and diagnosis? Like, what are the most common symptoms of menopause, and how can healthcare providers diagnose this at the right stage?
Okay, so as we know that it involves various systems. So the first thing would be all this patients have around menopause, perimenopausal age group. They have like irregular cycles, menorrhagia, that is increased bleeding, and then anything related to the menstrual cycle. So that will be around the perimenopausal age. But proper menopausal age, most of the symptoms are like genitourinary symptoms, like all this vaginal dryness, vaginal flushing, and decreased libido, and then or symptoms of osteoporosis like bone pain, tiredness, lethargy, and mood swings. So these are all the common ones which we need to know. And of course, obesity, we need to tackle all these problems. So based on these, we would recommend like a specific health checkup programs for the menopause women, like a yearly annual checkup. Most commonly, the annual checkup would include all this cholesterol, lipid profile, a thyroid profile, and a metabolic disorder like HbA1c and sugars to be controlled, and of course bone mineral density if indicated, and calcium levels and vitamin D3 levels. These are all the basic checkup which we could do for about annual checkup. And women should undergo a pelvic examination at least yearly once, and then at least pap smear at least once in 2 years, preferably yearly once, but at least in 2 to 3 years, because most women don't come for follow-up. They think it is not needed after menopause. So I think we should make it aware that like pap smear is very important, and then we should take this when they come to us for a regular checkup. I think as at least most of us are female doctors, I think we should be able to take this as an opportunity to examine their breast, because not many people do the self breast examination. So I think we should take that and tell them a little bit more awareness, cause a little bit more awareness about the breast cancer screening also. So I would prefer to do all this for my patients. So anybody else can add on any other investigations to be done.
Yeah, we should do a screening mammography and a pap smear test as a routine. Yeah, these should be always included in our workup.
Thank you, Dr. Tamarai and Dr. Shilpa, for your insights onto that. Moving ahead with the discussion to Dr. Indira Rani, I would like to know, please explain us how would we can understand the menopause in both medical terms and the everyday language for a layman to understand it better, and what are the key signs and symptoms that women should be aware of after a certain age?
Yeah, menopause is a word which is taken from Greek. It's a Greek word. Meno means month, and pauses means pause. That is stopping of periods. See, just stopping of periods is not menopause. At least 12 months of amenorrhea. That is 12 months, patient should not get any period without any pathological or a physiological cause. Then it is called menopause. Menopause can be a surgical menopause. It is not age related. It can be a premature menopause, and they have. I mean, it is when it comes to the professional what we think is it is because of the depletion of the ovarian follicles, which result in reduction of the estrogen, leading to the increase in the FSH levels. So there is no independent biological marker for menopause, and levels of FSH. There is a increase when FSH is increased more than 10 international units per liter. It indicates diminishing ovarian reserve. And if it is more than 20 international units per liter, it is diagnostic of ongoing ovarian failure in patients with vasomotor symptoms. And if it is more than 40 international units per liter, it is a diagnostic of menopause. And in everyday language, menopause is described as cessation of menstruation for more than 12 months without any pathology. And the key symptoms of perimenopause are hot flashes, breast tenderness, worsening premenstrual syndrome, lower sex drive, fatigue, irregular periods, vaginal dryness, urinary leakage, stress incontinence, urinary urgency, mood swings, and insomnia. And menopausal symptoms are mainly due to the reduction in the estrogen levels, which cause vasomotor symptoms, genitourinary symptoms, sexual dysfunction, neurological symptoms, sleep disorders, impairment in cognitive function, and psychological symptoms, cardiovascular disease with changes in the lipid profile, musculoskeletal symptoms due to bone loss, which is called osteopenia, and due to the muscle loss, which is called sarcopenia.
Thank you, Dr. Indira, for providing us with the insights on better understanding about the menopause. Moving ahead with the discussion to Dr. Shilpa, I would like to know, please provide us with the insights on hormonal changes. The hormonal changes that occur during menopause and how can they contribute to various symptoms that women experience during such time.
Yeah, there is reduced ovarian function, which leads to reduced estrogen. So, reduced estrogen in the body is responsible for all the changes that are seen in this menopausal transition. Estrogen is very important for the reproductive function, genitourinary system. It is important for cognition. It is important for cardiovascular health. It is important for our skin health, mental health, bone health, etc. So, when estrogen is reduced, naturally the FSH has negative feedback. FSH and LH hormones will increase in the body. So mainly, of course, AMH will also reduce, but these are not taken as a diagnostic criteria to check all these hormones to diagnose menopause. Generally, this is the symptomatology that we consider when a woman comes to diagnose menopause. In very rare situations, we check FSH to confirm that the woman is in menopausal transition. So it's basically the level estrogen reduction in the body which is causing all the problems.
Thank you, Dr. Shilpa, for providing us with the insights on the hormonal changes that occur during this stage. Moving ahead with the discussion to myths and coping strategy, I would like to know with Dr. Rabia, can you please provide us with the social support part that how can family and friends better support a woman going through menopause and what should they understand about this transition?
Yeah, thank you, Sumedha. During menopause, we have lot of changes in our mood swings and emotional state. So, from a shoulder to cry on and a person to giggle with, we need a family support as well as friend support. Because of the irritability and mood swings, we often shout at our kids and we have problems with in-laws and other people, and there will be a gap between the wife and husband over this time. So family members, especially the kids, in-laws and the husband, should understand that we are in the transition phase. Because of that hormonal imbalance, they are having the mood swings, and it's not intentional. So they have to give a social support, and psychologically and emotionally they should support. And in these times, even the friends, meno friends, we usually call them as meno friends. So more number of friends we get in, the more active we are socially, then there will be a good lifespan and a healthy lifespan for us, because we can be able to talk our problems to our friends, and whoever is in that phase of menopause, instead of being introverts, if we speak up and we tell that we are having these problems and those problems, then they will also understand that okay, this is a physiological problem, only I am not having this problem. So even the friends can help in this transition phase. So boosting up and giving a shoulder to cry on is something which family and friends is essential. So we need all the support, social support also.
Thank you, Dr. Rabia, for explaining this very positively and wonderfully. Moving ahead with the discussion to Dr. Indira Rani, I would like to know your views on to what are the myths about menopause and what are the prevalent myths that you heard that you encountered in your practice and how we can address this with the factual information when we talk about menopause.
Yeah, it's about menopause to be busted. You know, some people say hormone replacement therapy is very dangerous. But for a woman under 60 years of age and less than 5 to 10 years of menopause, HRT is much better when it is given than not given. So the risk of HRT is very low, and risk of breast cancer and all they are afraid of. It is not to be feared, because if it is given more than 60 years of age, or if it is given more than 10 years HRT, then only we should think about the risk of breast cancer. And it can be safely given to provide relief from hot flushes, sleep disruption, vaginal and bladder the issues, And in 18 years of follow-up, there is no increase in the death from HRT when it is taken for 5 to 7 years. So increased risk of heart disease and breast cancer in patients who are more than 60 years and if they are taken for longer periods, more than 10 years. HRT is contraindicated when the patient has history of blood clots, heart disease, liver disease, and certain cancers. And
Thank you, Dr.
the
Indira.
second myth, there are many myths. I didn't finish.
Yes, yes,
Menopause
please
symptom
continue.
doesn't last. Yeah, people think that the menopause symptoms doesn't last long, but they last long as much as 10 years. And the hot flushes and night sweats, sleep disturbances get better over time because the woman's body gets adjusted to the lower levels of estrogen and progesterone. And vaginal dryness, bladder symptoms like genitourinary syndrome improves with medication and vaginal estrogen. And the third myth is your symptoms will be awful. It is not like that. Only 20% of the patients they require treatment. Most are asymptomatic, and 85% of the women, if they have symptoms also, they might not need treatment. And fourth myth is your sex life is done so. Symptoms like low libido and dryness may affect the women's sex life, but HRT may boost the libido, and vaginal estrogen can treat the dryness. And myth five is natural remedies are as effective as the medications, but it is not the truth. Some supplements like evening primrose oil, it can be beneficial. Melatonin may help in sleep disturbances. Black cohosh may help in patients with hot flashes, and it should not be given in patients with liver disorders. And some people say menopause makes you forgetful. It is menopause in a true sense. It will make you forget, a little forget, but it will not cause any forgetfulness or memory loss. And some say as soon as the period stops, the menopause has achieved. It is not like that. It takes at least 12 months of amenorrhea, which is preceded by irregular periods, which is perimenopause. Some say it makes it irritable. Menopause makes the women irritable. Menopause itself does not alter the mood, but the symptoms like hot flashes are very messy. And ninth myth is, I mean, you can't get pregnant. No, it is not. Within the when the patient is perimenopause, sometimes ovulation can occur and then the pregnancy can occur, but it is very unlikely. And 10th myth is it makes you gain weight. Yeah, patients deposit fat around the waist because of the slower metabolism. So eat less, move more, and include the strength training exercises. So these are the myths which we come across.
Thank you, Dr. Indira, for busting out these myths and for providing us with these valuable insights when it comes to menopause. Moving ahead with the discussion to Dr. Shilpa, I would like to know your views on to, mental health impact. If we talk about the mental health, how can menopause impact women's mental health, and what signs should women watch for regarding anxiety and depression, and how to deal with such things during this transition?
Yeah, now by now we know that estrogen is very important for the cognition and major mental functions in a woman. So menopausal women may be affected with memory, sleep disturbances. They may have dementia, and then memory loss. Uh, uh, Reduced concentration, learning disabilities. So, I mean, slowly there could be some changes at this point of time. Each person is not the same. Around the changes can be different in different women. It also depends on their social background, education, and then support systems. But then the treatment for all this could be de-stressing, yoga, etc. How far this hormone replacement therapy will help these functions is not clearly understood. But definitely there is a certain level of deterioration in the high mental functions in some of these women, basically cognition, memory, and then in very severe cases, at an advanced stage, we may see symptoms such as dementia.
Thank you, Dr. Shilpa, for providing us insights on the mental health impact when it comes to menopause. Moving ahead with the discussion to Dr. Tamarai, can you please explain us how does menopause influence long-term health risks such as osteoporosis and heart disease, and what preventive methods or things that women should be aware of?
Okay, so as we are going into the discussion, as we have come across many times that the decreased estrogen levels is the main cause for most of the long-term problems, especially the osteoporosis, cardiovascular diseases. Decreased estrogen causes increase in LDL. It decreases the HDL, so which is very important for the maintenance of the lipid profile and to maintain the flexibility of the arterioles. And because of this, there can be some plaque production within the blood vessels, and it can go on, they can go in for cardiovascular disease. Apart from this, and also the patient's own risk factors like familial history of atherosclerosis, like increased lipid disorders or cardiovascular disorders, or obesity, lifestyle, like sedentary life, all these also affect, along with these menopause changes, the familial and lifestyle changes also, lifestyle changes also add on to these problems. So that is about the cardiovascular. Even osteoporosis, 20% of the bone mineral loss happens, but not immediately as the menopause sets in. It does not happen on the day of, like we know that it's a slow transition period over 1 year. So usually around fifth to sixth year of post-menopause, usually this osteoporosis starts setting in. So we should understand the risk factors for these are, like not maintaining enough calcium levels, like vitamin D3 levels and all that. So we should have a regular checkup for these, and then we should have some place for like changing your dietary habits from previous life to this menopause transition, like having a healthy diet, including more of calcium, vitamin D3, and then to include more of little bit more of all this plant source phytoestrogen products like legumes, pulses, and soya. All these have little bit more of phytoestrogen, so that also will help to some extent of maintaining this. And as Madam already said, like cognitive disorders, like long term, when we think of long term cognitive, breast cancers, urogenital disorders, all this. So, the major lifestyle changes will cause a smooth transition, and like starting a process of like proper exercise at least 5 days a week, 30 minutes, 5 days a week, which includes both aerobic and strengthening exercises, so that the muscle mass and the bone mass are built up very well. To avoid stress reduction, family support, maintain a proper sleep hygiene, and to keep a proper mental well-being. Like we should be like learners, maybe develop some new hobbies, do some like some crosswords and things like that, so that you keep your activity-based, mental activity-based, like hobbies or things like that. That works in a better way actually. And for vaginal
Thank
dryness, maybe they can use lubricants and vaginal estrogen as prescribed, but lubricants help them in a longer way.
Thank you, Doctor, for providing us with these insights onto that. Moving ahead with the discussion to Dr. Indira, can you please tell us, what practical strategies or lifestyle changes can women adopt to manage menopause symptoms effectively? What recommendation or advice you want to give to the people out there?
Uh, their lifestyle modifications, like in the diet, they have to change their diet to high protein and less fatty diet. They have to do exercise, walking, aerobics, yoga, and then weight strength. They have to do weight training and all to strengthen their muscles.
And Dr. Indra, if we talk about the support networks, advocacy and support, so how important are the support groups in helping women navigating menopause, and what resources are available for the same?
Yeah, support groups are very necessary to make women uh, aware of the menopause and its symptoms. It gives women opportunity to learn the healthcare from healthcare experts and other women who are having menopause. It helps women navigate the potential negative impacts on health and well-being. It helps in smooth transition of menopause as it is a natural phenomenon. They can meet other women who are going through the same symptoms and learn from each other. Some resources that can help women with menopause are Indian Menopause Society, a national society that aims to promote the well-being of older and mature women. But unfortunately, we have only one society here, unlike in US and UK. The support groups are very less here in India.
Well, thank you, Dr. Indira, for providing us with the insights on support. And I think women should know about these support networks and should come outside actively to talk about it and ready for the open discussion when it comes to menopause. Moving ahead with the discussion to Dr. Shilpa, since I mentioned about the taboo, so in your view, what steps can we take to remove the stigma and this mistangle about the menopause and encourage the women to open discussion?
Yeah, we should encourage them for open discussion, and probably when we meet them, we should ask leading questions, as in if they are having any sleeping problems, sexual dysfunction, urogenital symptoms, and we should inform them that these could be physiological and there is no stigma around it. And mainly, I think self-help groups makes a lot of difference, because when we know that people in the same age group are having the same issues, basically friends, so then that will give kind of confidence. Okay, I'm not the only person suffering. So that's when the a person will feel being positive about it and try to sort out. See, not that everyone will need medical therapy. So there are people who will be managed just with simple behavioral changes, lifestyle changes. Only a certain group of patients may need pharmacological therapy for conditions such as hot flushes, osteoporosis, and cardiovascular issues, and etc. So the probably, as I said, it should be a window of opportunity. Whenever we see a women above the age of 40, we should start discussing with them about menopause and its transition and the symptoms. And also there should be openness from the consultant side also. And also, as I said, it's not just a gynecologist job. It may be a entire situation which can be handled by a physician, dermatologist, any other specialty doctors who meet menopausal age group women, just to discuss with their symptomatology as in sexual health, urogenital issues, mental status, sleep disorders, and everything. And also that should be taken as a opportunity to check for all other cancers, and screening tests should be performed. Probably awareness should be made in the social media and in the communication, and also maybe at a public level, maybe government can take some initiatives so that their general health checkups are included as package.
Thank you, Dr. Shilpa, for providing us with these insights. On following up of that, I would also like to know your views onto that. When it comes to menopause, there are certain associated disease also come at this stage and during this transition. Like it affects their bone health, also the whole metabolism. So, can you please provide us some recommendations or maybe advice to the people out there who they can follow and can be able to face this during this transition? How it can help?
Didn't get your question. Other, can you repeat
Uh,
the question?
Yes, Dr. Shilpa, I was saying that during this transition, there are so many associated symptoms are also included. If we talk about the bone health, if we talk about the metabolic changes, if we talk about the hormonal systems. So, what advice or recommendation you want to give to the people out there who are in this transition?
Yes, we will advise them to maintain a general health, where we ask them to maintain regular diet program and exercise program to maintain their weight. Hypertension, diabetes are common after this age, say 45, 50. All these problems should be addressed. And then cancer screening can be performed yearly. Basically, we are looking at uterus cancer and breast cancer in women, and also those patients who are at higher risk of osteoporosis. A bone mineral density can be done, and a cardiovascular risk assessment can be done depending on their weight and hypertension, diabetes, and lipid status. So depending on their complete history, the investigations can be targeted.
Thank you, Dr. Shilpa, for providing us with the insights onto that. Moving ahead with the discussion to Dr. Tamarai, we talk about the education initiatives. So, how can these educational programs be curated or designed to better inform women about the menopause, and how can healthcare provider address this situation in a better way so that women can also come and encourage herself for the open discussion and to how to deal with this transition?
Okay. I think this support group has to start from the family level. I think every person in the family should be able to understand what a woman is going through during the menopause stage. So the support system has to start from the family level, from children, husband, and people around them in the family. So that is the main thing. The next level would be the friends, the peer group who are in that menopause, as Madam mentioned, meno friends. So we should that peer group and the social support. Maybe we should have some educational programs to give them some booklets and some materials to read about, like some short bulletin points, like not too many words, like easily understandable bulletins when they come to the clinic. And we should have a tailored approach for each person, because we'll have different kind of women. We need to know the triaging for women during the menopause, like who's coming for screening, or women without symptoms, they just come for screening, or women who come with symptoms, or we have women with risk factors. So we should be able to triage them into different groups, and then I think we should be having a tailored approach. Preferably a one-stop clinic would be better, but like in India, that was, like involving multidisciplinary approach in a smaller clinics may not be possible. Maybe in a bigger hospital, like involving a general physician or endocrinologist, cardiologist, ortho, like a holistic approach would be better. But at least when they come to us as a gynecologist, I think we should be able to give them a overall approach of whatever has to be, looked for, and what when for how frequently they should be able to come for a checkup. Like the importance of an annual scan or pap smear, mammogram, breast examination at home. So based on these, I think we should be able to let them some basic things, and then make sure that they come to us for follow up at least yearly once, so that anything can be picked up at an earlier stage.
Thank you, Dr. Tamarai, for providing us with the insights on such initiatives. And I think we should really incorporate all these initiatives to aware women more about the menopause and this transition phase. Moving ahead with the discussion to Dr. Rabia, I would like to know your views. What role do the healthcare providers play in advocating for menopause awareness and ensuring that women receive appropriate care during this transition?
Well, healthcare providers are very important, and they can educate the patient regarding the symptoms and the transition of the menopause, and they can tell them about the lifestyle changes that they can do. They can conduct the awareness programs, and they can educate mainly, so that people can understand that menopause is not a disease, and it is just a part of a stage in life, and we can easily transit that period provided we take adequate care. In the same way, the healthcare providers can help the person to take help in taking decision making, whether depending on their symptoms, some people are in a dilemma whether to go for hormonal treatment or non-hormonal treatments or any other thing. So they can be open. Healthcare providers should openly listen to their problems of the patients, and so that the patient will think that, okay, there is someone to take care of me, to listen. So we can give them a social support. The healthcare providers can give them a social support, and at the same time, we can tell them the need for health checkups, like regular breast examination checkups or cancer screening programs or anything, so that they can be aware of that. In the same way, even a dietitian can help, because weight gain is a major problem because of the increased fat cell hypertrophy which occurs in the truncal area, more of abdominal fat and buttocks and all these things. So figure correction is important. So dietitian can help us in correcting the figure and in maintaining the proper diet. So along with that, mental health person, in the same way, in order to counsel the patient regarding the mood swings and the depression which occur during this period. And at the same time, obesity training given for yoga, meditation, and all these, they boost up the self confidence of the patients during this phase, not patients, of the persons during this phase. And we can take a care from the we can take a help from the healthcare providers during this phase. Thank you.
Thank you, Dr. Rabia, for providing us with these insights. And the following up of that, I would also like to know from you, I mean, what advice or recommendation you want to give to the people out there who are in this transition, that we all know that it impacts the bone health, it also impacts their other systems of the body as well. So how can women deal better with this on their own? Like what things that women should incorporate that can help her out during this transition?
Well, depending on the problem which they are facing, like if the patients are facing facing hot flushes, then we advise them to take to wear cotton clothes, easily absorbent clothes, and use less of spicy foods, avoid the caffeine, other hot drinks, and use ventilated to go advise them to go in ventilated areas, and uh, to if needed, they can even go for non-hormonal treatments like phytoestrogen, tibulones, and all those things. And in case of need, they can even go for HRT, like hormonal treatment can also be taken. In the same way, we usually address about the risk of fracture, because the bones become very brittle due to the lack of calcium in this time. So we advise them. Usually, the wrist is the common area which gets frequently injured, because suddenly they'll be walking or doing any work, and they lifting the wrist as a support, and police fracture is something which we see.
Yeah.
And accidentally they slip down from the bathroom or doing any work, and they have hip fractures, and multiple fractures will be seen. So during this time, I we usually advise them that we have to deposit calcium in our body, that is in our bank. We have to deposit calcium during from the young age itself. And additional, along with calcium supplementations, proper diet should be taken, which is rich in calcium, vitamin D, in the form of milk, egg, fish, fish oils, and cereals, pulses, sprouts, and avoiding spicy foods. Added to this, the cardiovascular symptoms and the risk of hypertension and stroke is something which is alarming cause. So we advise the patients to take the less spicy food, decrease the salt intake, and increase the exercise daily routine, at least 10,000 steps per day, and do meditation and do whatever you feel happy, because of the advancing age, that we are reaching the menopause at the age of 45 to 50, and we are living till 80 to 90 years. So half of our life is being spent in the postmenopausal age. So we have to pass this stage happily. So eat healthily, and be happy, and talk with your friends, share your views, don't be an introvert, and be happy and be open up, because even the societies have come into existence that we are helping you, and the family is taking care, everyone is here to support you. So this is not a disease, this is just a phase, it can go off.
Thank you, Dr. Rabia, for these valuable recommendations and advice. And I think this is going to be really beneficial for the people out there who are listening to this. Moving ahead with the discussion to Dr. Indira, I would like to know what clinical criteria do we use to evaluate the severity of the menopausal symptoms in a patient, and how does this influence the treatment decisions?
In you have to have menopausal clinics for this, so that the patient can be given a rating scale, menopause rating scale. It's a standardized tool to assess the menopausal symptoms, and it is widely used to assess the symptoms of menopause and their severity. And it is a validated questionnaire that consists of 11 items, which are grouped into three categories, that is somatic, psychological, and urogenital. And each item or in the menopause symptom, which is graded and on 5-point Likert scale with minimum score of 0. And then it is like none, no symptoms, mild symptoms, moderate, severe, and extremely severe. And they are given a score of 0, 1, 2, 3, 4. And this helps in menopausal rating scale, helps in measuring the changes in symptoms before and after treatment, how the patient is after the treatment and what are all the symptoms, how it has become from severe to mild, we can make it on the rating scale. And there is no cutoff score that can be used on objectively indicate the need for the treatment. The patient should decide whether treatment is needed. Symptoms rated very severe on the menopausal rating scale require treatment, mostly MRS score of more than or equal to 14. They need treatment for climactic symptoms. And in clinical practice, a score of 4 for any of the menopausal rating system item could be taken to indicate the need for treatment. Anything which is extremely severe, any symptom, that should be treated. And like in the symptoms, it is given like hot flashes, episodes of sweating, heart discomfort, unusual awareness of the heartbeat, heart skipping, heart racing, tightness, sleep problems like difficulty in falling asleep, difficulty in sleeping throughout the night, waking up early in the morning, and then depressive mood, feeling down, sad on the verge of tears, lack of drive, mood swings, irritability like feeling nervous, inner tension, feeling aggressive, anxiety, inner restlessness and feeling panicky, physical and mental exhaustion like general decrease in the performance, impaired memory, and lack of concentration and forgetfulness. And sexual problems like change in the sexual desires, activity, and satisfaction, bladder problems, difficulty in urinating, and increase in the frequency, and bladder incontinence. And dryness of vagina, sensation of dryness or burning in the vagina, or difficulty in sexual intercourse. And joint and muscular discomfort like pain in the joint, rheumatoid complaints, all these symptoms are given in the rating scale, menopause rating scale. And accordingly, if they are mild, moderate, severe, or extremely severe, we score them. And then according to the, if they are extremely severe only, the treatment is HRT or any other treatment is required. If it is, or even the single symptom has a score of 4, then we have to treat them. And we can analyze them after treating whether the extremely severe has become moderate, mild, or it has gone, the symptoms have gone, we have to rate on that scale.
Thank you, Dr. Indira, for providing us insights in terms of evaluating the symptoms of menopause. Moving ahead with the discussion to Dr. Shilpa, I would like to know about the assessment of risk. I mean, how can we access the individual's risk factors such as family history, or I would say the personal history, health conditions, before recommending any of the therapy or any other treatments?
First of all, I will look at the age of the patient. If the patient is within 10 years since the menopause, or if the patient is less than 60 years, the benefits outweigh risk. So, if at all the patient needs this HRT for any of her condition, we can definitely prescribe if she is in this age bracket. And coming to the type of the hormone that we use is very important. Generally, estrogen alone, uh, if there is difference when we give estrogen alone or estrogen given in which route. Generally a transdermal route and a local application is generally safe. Local application, we need not bother about any kind of risk factors when we give local preparations. So patients should be made aware of these preparations when they have genitourinary symptoms or sexual symptoms. And also transdermal approach can be used whenever a person is at higher risk of venous thromboembolism and some autoimmune disorders where they are at higher risk of thrombotic problems. Also, we also adding progestogens will help. Especially when patient is at higher risk of uterine cancer or when we are treating a menopausal lady with the uterus in situ. Then coming to, we have to take a complete health history of the patient before we prescribe hormone replacement therapy. Any risk of estrogen sensitive cancers such as breast cancer or uterine cancer, any risk of venous thromboembolism, liver disorders, history of stroke, and history of osteoporosis, all these things should be taken into consideration before we prescribe hormone replacement therapy. Absolute contraindications for hormone replacement therapy includes abnormal uterine bleeding, estrogen sensitive tumors such as breast cancer and uterine cancer, and increased risk of venous thromboembolism, coronary artery disease, chronic liver disease, and increased triglycerides. These are the conditions we generally tend to refer from hormone replacement therapy. So, but definitely there is a scope for hormone replacement therapy in a certain population where they are not relieved with simple non-hormonal therapies or lifestyle modification. Definitely a role of local application cannot be overemphasized. It is definitely very, very crucial in the management of the symptoms, and transdermal approach can definitely be considered whenever the person is at higher risk of systemic therapy, oral therapy. Also, sometimes there is no particular cutoff when to start hormone replacement therapy. We can continue irrespective of the age if they don't have high risk factors.
Thank you, Dr. Shilpa, for enlightening us with these insights onto that. Moving ahead with the discussion to Dr. Tamarai, we talk about the long-term management. How can we approach it of menopause symptoms, particularly in the women who may experience the symptoms for several years?
Okay, now that we've spoken about the hormone replacement therapy, so we know the importance of hormone replacement therapy and for how long to use it. Most hormone replacement therapies are very safe for a few years, for about 5 to 10 years. So I think if the patients are having, they're very symptomatic, and as suggested, like menopause scoring can be attained, and then we can start off the hormone replacement therapy as and when required for each patient, like a tailored approach. There's no particular rule that this person has to be started, this woman should not be started, and things like that. But apart from absolute contraindication, so we should keep that in mind. And usually, all this breast cancers and all that also will start only after about 7 to 10 years of. Starting the HRT, and we are going to, once we start them on HRT, we are going to monitor them, or yearly annual examination and evaluation will be needed. So they should be under follow up. So that is one thing. We cannot just start up until you take it for however long you want. So we need to have them on a regular follow up period. So that is one thing which we want. So apart from this, I think dietary role is a very, very important role, because calcium is very essential and which is easily available in both diet, and we can also get the easily very much available calcium tablets, just about 1 gram to 1.5 grams per day. With that, maybe we should just add on some more multivitamins like antioxidants, vitamin C, vitamin E, etc., to like help in overall general skin and breast tenderness and all those. It helps in the vitamin E, helps in breast tenderness, and also the skin hydration part, that is important. The next thing which I really want to emphasize is on the role of exercise. Exercise is very important. All kind of exercise like aerobic, strength training, and then yoga or meditation. But of course, you should not be overdoing it, especially people with osteoporosis. You should not strain so much to, fracture your hips and knees and all that. So, under supervision, they have to learn under supervision, and it has to be followed according to the prescribed way of exercising. That is something which I really want to tell. And the next would be the sleep pattern. Try to maintain a sleep pattern, not to look into like gadgets till as long as possible. Try to cut out, put a stop to it at some time of the day, some time of the night, and start like a regular sleep pattern, and get a proper mental health support in case of any mood disturbances or anything. There's nothing wrong in going for a counseling. It does not mean that you have a psychiatric illness. So that is something which we need to do. All women go through this transition period. At some point or the other, there would be some sort of mood disturbances, changes. Does not mean that like you have a like major psychiatric problem. So maybe just small amount of counseling for few minutes to few hours of counseling will help in a long way. And go for a regular checkups. This is what I would suggest.
Thank you, Dr. Tamarai, for such an insightful suggestion in management of menopause. Moving ahead towards the discussion and to conclude it, Dr. Rabia, I would like to know the importance of personalization of care. How important it is to personalize treatment plan for a menopausal symptom based on individuals' experiences and the health backgrounds.
Depending on the symptoms which the patient have, each and every patient and at what time they have reached the menopause, what problem they are suffering, we have the personalized treatment for them. So for every person, personal care depends. It differs from person to person. So if they are having hot flushes, we have to, as I told you, that hot flushes can be there for some people for about 3 to 4 years. For some people, it persists for about 8 to 10 years. So we advise them accordingly to change the lifestyle habits, and some non-hormonal treatments are given, and some cases we even give hormonal treatments. In the same way, if the patient is having a dry vagina or if they are having painful intercourse, then we have to advise them to take lubricants or estrogen creams or tablets or jellies, and latest intrarosa, which is human-made DHEA, is inserted in the vagina. It decreases the pain during the intercourse and it aids in the lubrication, and it prevents the vagina from the atrophic vaginitis. And added to that, if there is diabetes mellitus for the patient, the problem of vaginal itching and this dry vagina becomes more problematic. In the same way, the dry skin, because of the lack of estrogen, we advise the patients to take more of moisturizers and keep them hydrating by drinking plenty of water in order to prevent these problems. In the same way, if the patient has depression, then we give them social mental support and counseling, and if needed, if the patients are very much depressed, we even have to treat them with antidepressants and other psychosomatic treatments. In the same way, osteoporosis. If they are in the range of osteopenia, we advise them to take calcium intake in order to increase their bone mineral density. And if they are osteoporotic, we even advise them to take calcium and alendroids and other bisphosphonates and other things. So every individual, depending on the symptoms which they have, their personal care depends, and it differs. So we have to address on what problems the patient is facing. Thank you.
Thank you, Dr. Rabia, for these insights on personalized care. As we conclude our session on Midlife Reimagined, a 360 approach to wellness and renewal, we have gained such crucial insights into menopause, including signs, symptoms, and health implications. While we debunk the myths that often perpetuate the stigma, it's clearly increased awareness and open dialogues are essential for empowering women during such transition. So let's take the knowledge we have shared today and turn it out into the action for advocating the better health resources. And until the end, I would like to extend my gratitude to all the panelists for your insightful contribution and for sharing your expertise with us today. The participation has been really valuable and we deeply appreciate the knowledge that you have shared. Thank you for joining us and for contributing to this important conversation. Thank you so much.
Thank you,
Thank you.
Rabia. Thank you, Winters. It was a good
Thank you. Thank you so
program.
much. Thank you.